Hi everyone, today we're going to dive deep into the process of a tummy tuck surgery. Who needs a tummy tuck surgery? Are you the right candidate for it? So let me start by telling you why a tummy tuck surgery would be needed. A tummy tuck surgery can be done for both men as well as in women. In men, we usually do a tummy tuck surgery when they have completed a massive weight loss or post-bariatric surgery. So post-massive weight loss, which also happens after excessive diet and exercise or after bariatric surgery, and you lose a lot of weight, one experiences sagging of a lot of skin around the abdomen area, also accompanied by a little bit amount of stubborn fat in the abdomen area. So in that case, we usually choose a tummy tuck surgery for men who are not able to get rid of that sagging skin in the lower part of the belly. It is causing them functional issues due to the hanging belly bulge. They are not able to even walk properly, exercise properly, and that is when they come to us and we plan a tummy tuck surgery which is done for men, which is very similar in terms of surgical technique even for women. In women, why we choose a tummy tuck surgery? Those who have had multiple pregnancies and post multiple pregnancies, they have seen an expansion of the abdomen area. In most scenarios, there is a hanging skin pouch in the lower part of the belly. Usually, the midline abdomen muscles are separated. Sometimes there will also be a hernia in the midline of the abdomen or at the belly button area. In these cases, stubborn fat is also accompanied around the waistline area, in the upper abdomen and in the lower back region. Now, I suggest to all women who have had their pregnancy, tummy tuck surgery should be done when you have completed your family. Why? Because in a tummy tuck surgery, we're going to have a long scar because of the skin removal, and this scar in your later pregnancies is going to widen, it's going to spread, and remember, the result of the surgery is obviously going to be lost. Once you have stopped breastfeeding, you need to wait for at least 8 to 12 months. Allow the hormones in the body to take rest. Try to get on an exercise, a good lifestyle, try to lose back all the pregnancy weight that you had gained, and then you must seek a tummy tuck surgery. Now let's look at how we do a tummy tuck surgery. The surgical technique is rather similar for both men and women, and let me take you through the steps of how we do it. So there are a few types of tummy tuck. Let's come to the most minimalistic tummy tuck procedure, which could just take about 1 to 2 hours. Now just remember, imagine you have excess skin in the lower part of the abdomen. Now, if you have lost a lot of weight, you have come down to your normal BMI, you have been exercising, you have been toning the midline muscles here, and you have tried to bring back the muscles in the midline, the weak abdomen muscles, and you just have a tiny amount of skin pouch over here. So we will do a mini tummy tuck for you. That means you will have a really short scar. Just removal of the little belly bulge over here, and we will tuck in the excess skin, and you will have your scar line just above the suprapubic region. If you have a lot of hanging skin which extends both to the sides of the abdomen, then we have to do what we call a traditional or a classical tummy tuck, where we have to remove all of the skin all the way up to the side and tuck the top part of the skin onto the bottom. I know you will be worried about the scars. I have such a long scar of the tummy tuck surgery, it will look very ugly. Yes, in the beginning, these scars tend to look very prominent because they are extending from one end to the other. And if you have a lot of hanging skin even going to the back, that is the lower back area, sometimes we have to do a belt lipectomy, or we have to extend your incision to remove the skin even to the sides. But in most cases, we come across people who have restricted scars coming to the sides of the abdomen. Now we have to do that because if we try to cut short your scar, we will pull the skin and you may get a lot of gathering in the sides of the abdomen which don't look good later. But the best part of this is I plan your scars within the underwear line. We try to make sure that these scars will be hidden even in your bikini. When we look at a mini tummy tuck or a moderate tummy tuck scar, Many women also have undergone C-section previously, and you would know with a C-section you have a scar in the very same spot which is almost as big as a mini tummy tuck scar. So why bother? Those women are not concerned as long as the scars are hidden and they can wear their bikinis again and it's hidden with the underwear line. They can wear low waist clothes and show off their midriff abdomen. So in these cases we use the C-section scar, and then I will extend the incision, the scar, a little bit to the sides, all depending on how much skin removal I need to do. Every tummy tuck is accompanied with a liposuction, and I like to do a 360-degree liposuction of the abdomen. We will do liposuction to give you a waistline. We will remove a little bit of the love handle fat, and of course the most important step is repair the weak midline abdomen muscles. So we need to bring these muscles to the center. Once I repair your weak muscles, it's up to the patient to tone the muscles with good core strengthening, and it could take 6 months, a year or more. And while they keep toning the muscles, you will realize and see that the muscles which have been repaired will take a better shape. So the best results of your tummy tuck surgery would be seen in about 3 to 6 months as you start your exercise protocol and maintain a good nutrition. Would you want to know what is the medical term for tummy tuck? It is called as a lipo-abdominoplasty. And why? Because we combine liposuction along with the abdominoplasty, which is the tummy tuck. And I do it with my amazing technology. This is the Vaser liposuction that I use for the liposuction. This is a high frequency ultrasonic lipo with vibration. And this is the VibraSat Pro, which is one of the latest generation power liposuction machines. Dr. Karishma Aesthetics was one of the first clinics in Karnataka to launch this machine 6 years back. So with all my experience with this technology, we are able to give you the best results of a lipo-abdominoplasty. If you liked our videos, do like, share and subscribe. In case you are interested in availing any of our treatments, do connect with us on www.kaestheticsin. If you would like to visit us, do visit Dr. Karishma Aesthetics at Indiranagar, Bangalore. Thank you so much for watching.